Hey every student, congratulations to my channel. Uh, Today I will discuss you about the pathology or histopathology of the kidney. Let's go to our topic. This is the histological slide of amyloidosis of the kidney. How can we understood it is a kidney? See that here. This is the glomerulus of kidney. This is the glomerulus of kidney, and these are the Bowman's capsule. Please note to my mouse pointer. These are the Bowman's capsule, and this is glomerulus. You see that glomerulus, this point indicates deposition of amyloids. We know that amyloids is deposited in the wall of the arterioles. Wall of the arterioles. These are the arterioles, renal artery, and here amyloid depositions is occurs. The red marks indicates amyloids. And we know that glomerulus is the top of capillary, so here have a chance of the depositions of amyloids. That results deposition of amyloids in the wall of the glomerulus. So it is it may be, and you notice that lumen is dilated, proximal convoluted lumen dilated is dilated, and all the septa are rich in inflammatory cells. So we can say that this is the amyloidosis of the kidney. Let's go to the next slide. It is the another slide of amyloidosis of kidney. When we stain the tissue with the conglomerates, we can see this type of lesions in the microscope. Like that, this indicates deposition of amyloids. This also indicates partial deposition of amyloids, and here the arterial wall also indicates that here the deposition of amyloids is occurred. So it called amyloidosis of kidney. Let's, my dear viewers, goes to the another slide. Sorry, not channel. This is acute pyelonephritis. How can we understood acute pyelonephritis? Pyelonephritis refers to that pass in the urine. You saw that a granules is you saw that abscesses are present. That means caseous mass. Here these 2 points indicate germ colony. We know that here also present neutrophil, inflammatory cells, etc., etc. You also notice that these are the normal, but here here you please note to my mouse pointer. Here also deposited neutrophil in the proximal convoluted tubules. These are only occurs when acute pyelonephritis is occurred. And you note that in this slide the glomerulus is normal. How we say that the glomerulus is normal? You see that here the Bowman's capsule is normal, and if the Bowman's capsule if there is no space of Bowman's capsule present, then we can say that the glomerulus is abnormal, because that occurs when the glomerulus are inflamed and deposited of the inflammatory cells in the top of the capillary. That indicates that the glomerulus is abnormal. So that there is nothing is occurred in this slide, so we can say that the glomerulus is normal. And this slide indicates that this glomerulus indicates that it's a slide of kidney, and these things indicates that is acute pyelonephritis. Let's go to the another slide. It also acute pyelonephritis. You see that germ colonies and caseous masses as well as neutrophils, abscesses, pus, fibrous connective tissue, and normal glomeruli. So it is acute pyelonephritis. Let's go to the another slide. It's also called acute pyelonephritis. It's the gross view. You can see in the surface of the kidney some yellowish abscesses. Hollow, or we can say that foci. And the size of the kidney is normal. or slightly enlarged. This indicates acute pyelonephritis. Let's go to the another slide. This is toxic tubular necrosis. Why we call this toxic tubular necrosis? Because you see that the proximal convoluted tubules, these are the proximal convoluted tubules, these are necrophyte. How we understood necrophyte? Because in case of normal proximal convoluted tubules, here have a nucleus. Here the layer of cell present that will contain nucleus, but here no nucleus is present. This indicates that necrosis is occurs in the proximal tubules, and we see that glomeruli is normal, so this indicates that it's a slide of kidney, and here toxic acute tubular necrosis is occurred. Okay, this is also a view of toxic tubular necrosis. Here you note that necrosis is occurred, just one or two in this slide. Here somehow partial necrosis occurred, but here fully necrosis occurs, and here also fully necrosis occurs. What are it? It's the cross section of proximal convoluted tubule, because it's situated near to the glomeruli, and you see that this the tuft of capillary and afferent arteriole and efferent arterioles. So this is the slide of toxic acute tubular necrosis. This is the slide of kidney. How we understood this is the slide of kidney? Because you see that the interstitium and here and the glomeruli is disattached, and it here hyaline deposition is occurred, so that we can so that the glomerular architecture is completely disrupted and disintegrated. And here you see that renal tubules are also dilated, and here hyaline cast is situated. These are the hyaline cast. And in the interstitium you notice a lot of black spot. There's are the inflammatory cells. Actually, in case of chronic inflammation, chronic inflammatory cell comes. What are the chronic inflammatory cells? Chronic inflammatory cells are the lymphocyte, then macrophage, etc., etc. So we can say that this is the slide of the chronic glomerulonephritis. These are also a slide of chronic glomerulonephritis. Here you see there's totally hyalinizations is occurred in this glomerulus. But in this glomerulus, some point, this point, and this point, hyaline deposition is occurred. Hyaline deposition, so it is called partial hyalinization of the glomerulus, and it is called totally hyalinization of the glomerulus. And this point will be my look at my cursor point here. This is called hyaline, and it is deposited in the arteriole. It is deposited in the arterioles and tubules. So this termed as chronic glomerulonephritis. Okay, this is another slide of chronic glomerulonephritis. Chronic glomerulonephritis, that's enough. This is called acute. This is the slide of kidney, because here glomeruli are present. But notice that here the Bowman's capsule is reduced, so it indicates that there is something, inflammation is occurred in the glomerulus, or that means is the tuft of the capillary. And here you see that a lot of inflammatory cells are aggregated in the glomeruli, and so the glomerulus is inflamed. So, and you notice that these are the renal tubules, and this is normal, because here you see that the nucleus are lined in a row or in a serial, and they are not disintegrated. You see in the previous slide there was the nucleus disintegrated, but here no necrosis is occurred. This is the indications. This nucleus is the indication that there is no inflammation or necrosis is occurred in the renal tubule, but here inflammation is occurred in the renal globules, glomerulus. So it's called acute diffuse proliferative glomerulonephritis. Then goes to the another video, another slide. This is also acute diffuse proliferative glomerulonephritis, because here no Bowman's capsule, no capsular space present, but it is abnormal. So here and also inflammatory cell are also deposited here, but the tubules are normal, so it indicates that it is acute diffuse proliferative glomerulonephritis. Okay, these are the characteristics of polycystic kidney disease. This is the polycystic kidney. What do you mean by polycystic kidney? Polycystic kidney means here cyst present, and cyst containing fluid. Here you see that the glomeruli are the normal because they are in their shape, and Bowman's capsule are capsular space are present. And you noted that some the interstitial tissue or parenchyma is atrophied or depressed due to the pressure of the cyst, and those parenchyma which are situated in between two cysts, they are maybe compressed or atrophied. So we can say that this is the polycystic kidney disease. This is the gross view of the polycystic kidney disease. Here you see that a cyst, this is a cyst, and the tissue is atrophied and elevated surface, and the kidney is enlarged from its normal size. So this is called polycystic. This is the cross sections of the kidney in case of polycystic kidney disease. Thank you all the students and listeners for viewing my channel. If this video helps to you in your study, my video will be very fruitful. Then okay, assalamu alaikum.